Hi, my name is Kathleen Smith. I'm a physical therapist. I'll be working with a patient today who has had a traumatic elbow fracture and subluxation. The patient was immobilized in a cast for 7 weeks and is 2 days post-cast removal. So I'm going to perform shoulder mobilizations, elbow mobilizations, and wrist mobilizations to address the limitations that he now has. He complains of stiffness more than pain in the shoulder. So I'm going to address that as a clinical group 3B and address limits of stiffness versus pain. And in the elbow, he presents with much more complaints of pain, 7 to 8 out of 10 versus stiffness, although only has 15 degrees of available movement at 90 degrees of elbow flexion. And at the wrist, the patient, again, similar to the shoulder, is limited more by stiffness than pain, and so I'm going to address the wrist as a clinical group B as a 3B as well and address the stiffness. For the elbow, the patient presents more as a clinical group 3A, and so we're going to address pain more than the stiffness and let pain guide our joint mobilizations. Thank you. Okay, the first shoulder mobilization I'm going to do is a shoulder flexed to 90 degrees. I'm going to do an inferior or caudal longitudinal glide of the humerus in the glenoid joint. So I'm just coming, my right hand is just coming lateral to the acromion process. And again, I'm going to treat him like a clinical group 3B, so I'm going to address stiffness. And while I'm doing this, I'm going to say, how are you feeling? I'm going to watch the patient's face for signs of pain. So I'm going to go ahead and start with a grade 3. I'm just going to go 1, and then I'm going to move into a grade 4. So be small amplitude at the end of the range and into the resistance. So again, a grade 3 is through range, large amplitude, and then grade 4 is small amplitude at the end and into the limit. And that's with the arm at 90 degrees of flexion, longitudinal glide. Now I'm going to do a longitudinal caudate glide of the shoulder with the patient's arm to his limits of abduction, which is 90 degrees. His external rotation is about 30 degrees, I believe, so he wouldn't be able to externally rotate very much. I'm going to bring him out here. My mobilizing hand, my right hand is just lateral to the acromion process and on the superior surface of the humeral head. And I'm going to just give him a downward glide. And as I do that, if I can, I'm going to just try to bring his arm up into a little more abduction, if he'll tolerate it. Again, I'm going to ask him throughout, are you feeling okay? Is this giving you more pain? And check his face for symptoms of increased pain. So I'm going to begin with a state of grade 3. So it's full through the range to the limit, large amplitude. And then I'm going to do a grade 4, so I'm going to bring him to the limit and then do small amplitude. And again, I'm going to go ahead and bring him into a grade 3. And then I'm going to take him to the limit and do a grade 4. And that is a grade 3-4 inferior caudal glide. Now I'm going to do a posterior anterior movement on the patient's shoulder. I've got him supported with his elbow up on a pillow and his hand on a smaller support just to give him kind of a more neutral position. And I'm going to come in, my hands are going to be cupped with my right hand over kind of his scapula here, and then my left hand is on the humerus. And my thumbs are joining, and I'm going to give a little pressure pressure on the humeral head in the posterior to anterior direction. So I'm going to do a grade 3. Sorry, I'm kneeling here. Grade 3 and then a grade 4. So I'm going to go give a grade 3, so through range. And then a grade 4 would be end range, smaller amplitude. And again, grade 3, through range. Are you okay? And then again, a grade 4 would be end range. And that's posterior to anterior glide. Now I'm going to perform a AP glide on my patient. Again, I'm going to address the stiffness, clinical group 3B. So my left arm is going to kind of just support his humerus here. I'm going to raise it up a little bit. Support it against my forearm. I'm going to take my right hand, I'm cupping it over the head of the humerus, and I'm giving him a downward push. Now ideally, if I had a high-low table, I would make him lower so that I could use my body in more of a perpendicular line to create the forces. Unfortunately, we don't have a movable table. So I'm going to do my best to use my body mechanics here. Cup the head of his humerus in my hand here, and I'm going to go with a grade 3, so I'm doing through range. And then I'm going to do a grade 4, so bring him to the limit, and then a small amplitude. So again, I'm going to do a grade 3. And then I'm going to go ahead and do a grade 4, so bring him to the end and give him small amplitude into the resistance.